Hi guys, Dr. Berg here. In this video, I really want to talk about chronic pain after surgery. You probably know friends or family that have this chronic residual pain after surgery, and I want you to share with them what to do. I want you to watch this video, okay? Because it's so easy to fix pain that resides and is residual after a surgery. There's two things. One is a surgery is an additional trauma, because they're cutting you or repairing something, okay? Of course, you're under anesthetics, but your adrenal and the body still experience the trauma. You just you're not awake to feel it. So it is a trauma. It's necessary, but it creates more trauma many times, okay? So instead of showing you how to treat every single possible surgery that someone would have and what to do, I'm going to give you a principle and then show you a couple so you can think with it. One is that let's just take phantom pain, like cut off the leg, for example. And now you have pain on the phantom side of the leg. You have pain where they cut it, even though there's no leg there, right? Well, why is that? Because the left and the right side of your body, the front and back, are connected neurologically. You have nerves that cross over. They're on the same circuitry. When you have trauma to a body part, you lose nerve supply. You lose circulation, blood supply, waste removal. You basically lose the connection between your brain and that body part. What happens is your body will set up a kind of a stuck flow where now it's constantly hurting. Constant inflammation, it won't heal. Now, in the case of a leg being removed, you're just sensing where that leg was, but it's hurting right where you had the leg, which is fascinating, but it happens a lot. So here's what the principle is. What you want to do is never do therapy on the same location where you had the surgery. Do therapy, massage, acupressure on the mirror image. Now, if you've been watching my videos, you already know this, but the mirror image, why? Because it's on the same circuit. You can affect one part of the body and affect the other side of the body. Okay, so let's just take a look. Phantom pain. You had the leg removed on one side, no more leg, but you hurt down here. You do massage on the opposite leg, okay? And watch how the pain goes away. It's always going to be twice as tender on the opposite side of the leg. Now, you might be watching this video and be laughing and like, that's a joke, it's not scientific, whatever. But just go ahead and do it and see if it works. It's going to work. I've done this thousands, tens of thousands of times, highly effective, and it does work. So unless you try it, you'll never know, because that's how you get rid of phantom pain. Mastectomy, they remove a breast. Okay, of course, once they remove the breast, in the shower with maybe some lotion or something right after the shower, you could actually massage the opposite breast, because that would be the opposite mirror image side. It'll be tender on the good breast, and what'll happen, you'll actually knock out the pain on the area where you had the mastectomy. So that's how you would do that one. Hernia. Let's say you had a hernia down here on the left lower side of your abdomen. Just massage on the mirror image on the right side of the abdomen. Okay? And when you're talking about massage, it can be a gentle, irregular motion. It doesn't have to have any pattern to it. You can do it with a massage tool, your hand. You can do it with a vibration tool, whatever. Now, let's say you had a damaged pelvis on the left side of your pelvis. Just work on the opposite side, on the pelvis, okay? The key is getting the exact point of where you had the most trauma, like the epicenter on the opposite side, okay? Little secret there. Let's say you had low back pain, right? That was right in the center of your lower back. Well, what's the opposite side? It's on the front side. You work on the front, right here. So at the belly button, that would be L3. So you have to go like 2.5 inches lower to get L5. And when you work on that area, you'll find like, wow, it's tender right on that spot, because it's always going to be tender on the opposite side. Shoulder. You had, let's say you had surgery to the bicipital tendon on the left side. Work on the opposite bicipital tendon. Let's say you had a head trauma or surgery to your skull on this side. Work on the opposite side. Let's say you had a Morton's neuroma surgery on the bottom of your left foot, work on the opposite side. This is the most effective technique out there, and it is so easy to create a very cool effect. Thanks for watching. Hey, you probably already subscribed, but if you haven't, press this little button down below and I will keep you updated.